Well, that vote of no confidence in Jeremy Hunt came after speakers at the British Medical Association conference accused Hunt of denigrating the NHS and heavily criticising health professionals. Well, joining me is Dr. Chaand Nagpaul from the BMA in Edinburgh. Good evening to you, sir. Many thanks for joining us. You're a GP, but you helped pass this vote of no confidence in Mr. Hunt. Why?
Doctors across the NHS are feeling extremely unhappy, angry and frustrated at the fact that they're working in a system which is devaluing them and not recognising what they're actually contributing. In fact, it's ironical that the government has introduced reforms where it states that doctors have power to shape the NHS, and yet 65% of doctors surveyed by the BMA today show that they are actually feeling less empowered than a year ago. 70% of doctors feel their workload experience is worse than a year ago. 8 out of 10 doctors actually report workload pressures as being very high, and 9 out of 10 GPs report high or very high workload pressures. Now, that's the backdrop of how doctors feel in the NHS at the moment. And we feel that these pressures and this feeling of not being recognised is a result of working within a system that really has problems that need to be addressed in terms of government policy. And that's what this vote was about. It was about the deep unhappiness and frustration amongst doctors.
Well, having put yourself on this collision course with the government now, shouldn't you be looking at finding a common ground rather than passing a no vote of confidence?
Well, absolutely right. I mean, we actually don't want to have a collision course. We want to actually, we would be very happy to have dialogue with the Secretary of State to actually address the concerns that doctors have so that, as he himself would like, to put doctors into a position where they can contribute positively to improving the NHS. So, in fact, this vote is a vote demonstrating, or rather reflecting, the level of unhappiness, and the way forward is to actually address that level of unhappiness and the reasons why. And in fact, one of the sort of themes we've seen in recent weeks, for example, as speaking as a GP, is a lot of political comments made about, GPs, for example, not recognising how hard GPs are working. The fact is that GPs are working harder than ever. We're actually seeing more patients in our surgeries than ever, and we're actually taking on huge amounts of work at a very increasingly reduced level of resource within general practice.
Okay,
as an
Dr.
example,
Chaand Nagpaul,
hospital doctors are working under...
I'm afraid we're going to have to leave it there. Many thanks for joining us this evening.
Okay, thank you.